I've recently been getting a lot of patients in the office asking for ballerina boobs or asking about ballerina boobs. And so this is a trend that's been happening in the last few months. It's the propensity for patients to want smaller, more modestly sized implants. And they're really wanting a natural augmentation. So something that most people wouldn't even necessarily know that this patient had a breast augmentation. So you're using smaller implants that are maybe, 175 to maybe 250 cc's instead of larger implants like a 450 or a 500, 600 cc implant. Now, how the implant looks on your chest and how much volume it gives you depends on your existing breast tissue, how much you have, the shape of your chest, how wide your chest is, all of these different parameters. But for petite patients, they're generally coming in asking for a very modest, small sized implant. And it gives the appearance of a high, tight breast on the chest wall. So some people might be like, what is the point of getting a breast augmentation, getting breast implants, if it's, so subtle and nobody can tell? It's subtle, but there's a very definite difference. By having that implant in there, you're tenting out the skin. So patients who have gone through weight loss or pregnancy, breastfeeding, after those effects have worn off, the breast can often be saggy, or the breast envelope is loose. So placing that implant in there to add volume to the breast tightens, fills out that envelope to where the skin is now taut. So that gives a bold difference to the breast. Now, if you have had those changes like weight loss and pregnancy, you still might need a breast lift. So I have some implants here so you can see the difference. So this is a 450 cc implant. This is maybe slightly on the larger side, but it's somewhat in the mid-range of how large of a breast implant you can get. And then this is a 260 cc implant. So you can see it is much smaller. They're held side by side. And this will have a nice impact for somebody who has a narrow chest frame and kind of a petite build. So it's gonna give you an appreciable difference. It's just not gonna be a massive breast. So the moral of the story is smaller implants are making a comeback. You can have a small implant and still see a significant difference in the breast, see a great improvement. And you can have a very large implant if that's your preference and have that type of impact. They're both beautiful and you really have options.